Hello, this is Hao Zhongxue. I'm going to present my presentation. The thing we are going to study is cognitive link. So this, let me start from the background. So this one is a rapidly developing field of neurological rehabilitation. The cognitive link project stands out as a pioneering attempt with the goal of bringing out a transformation in the lives of people who are struggling to cope with the difficulties that are associated with neurological illness. So the goal of Cognitive Link is to provide a cognitive rehabilitation program that is highly individualized to the specific needs of each individual patient, which is very useful. This initiative is one of a kind because of its dedication to utilizing the most recent developments in brain-computer interface, short for BCI technology. This will make it possible to establish a connection between the human brain and a computer that is completely seamless. So through the use of this interface, patients are able to participate in adaptive cognitive exercise that has been precisely created to suit to the specific requirements and the rehabilitation objectives of each particular patient. And thus, the real-time monitoring of brain activity is the primary emphasis of the Cognitive Link project, which is the project's defining characteristic. So with the help of this cutting-edge feature, patients are able to acquire insights on the functioning of their brains as they are engaged in cognitive activities. Not only does the system have the capability to monitor progress, but it also offers instant feedback, which is an essential component of the rehabilitation process. So this feedback mechanism plays a significant role in the process of encouraging patients, helping them through the process of recovery, and ensuring that each exercise is suited for the specific rehabilitation requirements of the individual patient. So the research, what I'm going to explore, known as cognitive link, has the potential to revolutionize the field of cognitive rehabilitation as it continues to develop. Cognitive link is a demonstration of the potential of technology to produce good and transforming experiences in the medical field. It does this by combining cutting-edge brain-computer interface technology with an in-depth understanding of neurological healing. Cognitive is on the road to unlocking new possibilities in the journey towards cognitive rehabilitation and independence. So this is being accomplished by devotion, creativity, and a strategy that is centered on the patient. So next we're going to talk about the concept development stage. So the first is we need some analysis. The first is target population needs. So for this one, we're going to start with personalized rehabilitation, which is patients who suffer from neurological illness display a diverse array of symptoms and cognitive deficiency. It is absolutely necessary to take a personalized approach that may be adapted to the particular requirements and the rate of recovery of each individual. And also in target population needs, the engagement and motivation is when it comes to long-term rehabilitation programs. One of the challenges that must be overcome is keeping patients engaged and motivated. We don't want patients lost conscious, right? So cognitive activities that are both interactive and enjoyable have the potential to increase patient participation. And for the accessibility and usability, individuals with varied degrees of cognitive and physical ability should be able to easily utilize the system, and it should be user-friendly. Also, we need some continuous monitoring and feedback. So providing patients with rapid feedback and real-time monitoring of their cognitive function are both essential components for modifying treatment regimens and motivating patients by demonstrating progress. Next in the needs analysis is technological needs. Let me take two examples. First is non-invasive BCI technology. So creation of a reliable non-invasive brain-computer interface system that can precisely read and understand brain signals without the need for surgery. And next is adaptive learning algorithms. The application of machine learning algorithms that can modify brain testers in real time according to user performance and neural input. And the third thing in needs analysis is we need to do some like professional expertise. We need to high professional expertise and training needs is very important. So like the interdisciplinary team, the BCI system will be designed, developed, and tested by a highly qualified team that includes neuroscientists, BCI technicians, software developers, data analysis, and rehabilitation specialists. Everyone is important. And training for healthcare professionals is also vital. The entire training courses on the proper use of the cognitive system in therapeutic settings for therapists, clinicians, and caregivers. So, the implementation and the evaluation needs is like feedback mechanism, creating patient and the healthcare provider feedback loops to continuously enhance the system based on results and user experience. Also, the scalability and adaptability is as well as important. Make sure the system is adaptable and scalable to take into account new developments in technology as well as results from continuing studies in cognitive neuroscience and rehabilitation. And during the concept development stage, the second is concept exploration and concept definition. So the first we're going to start is foundation principles. So the foundation of cognitive link is the idea that direct communication between computational systems and the human brain might improve and facilitate cognitive rehabilitation. It seeks to offer those with stroke, traumatic brain injuries, and neurodegenerative illness a personalized, interesting, and effective rehabilitation experience. The initiative emphasizes the value of real-time feedback and the possibility of stimulating neuroplasticity. The next is technological landscape. So the development of non-invasive BCI technologies, which have demonstrated encouraging advancements in decoding and interpreting brain signals, is fundamental to the viability of cognitive. When combined with developments in machine learning and artificial intelligence, these technologies present the possibility of developing adaptive systems that can adapt to the particular rehabilitation requirements of every user. By introducing a sophisticated non-invasive BCI technology that enables customized cognitive workouts, Cognilink aims to transform cognitive rehabilitation. Its main goal is to help people with neurological illness live better, lives by improving cognitive abilities like memory, concentration, and problem-solving techniques. There are some key features. First is adaptive cognitive exercise. These exercises dynamically modify their level of difficulty and variety in responses to metrics tracking real-time brain activity. The real-time monitoring and feedback gives patients and medical professionals quick feedback, allowing for careful tracking of development and the efficiency of rehabilitation techniques. Data-driven insights makes use of gathered data to customize therapies, improve rehabilitation strategies, and provide forecasts about the course of recovery. The last we're going to talk talk about in concept exploration and the concept definition is impact and vision. So the goal of cognitive link is to set a new benchmark in cognitive rehabilitation by fusing neuroscience and technology to provide accurate, practical, and approachable treatment options. It aims to empower patients by giving them a sense of progress and control over their rehabilitation process, in addition to improving recovery results. So during the processing for studying cognitive, there are many challenges. So the four main concepts of the challenges starts from the technological challenges. So in technological challenges, assuring that the BSI technology can reliably and accurately read brain signals in a broad patient group while taking into account the variations in neurological patterns brought on by various conditions. Also, in the user interface design, making sure the technology is easy to use and doesn't add to the patient's cognitive load by designing an intuitive and accessible user interface for people with different degrees of cognitive and motor abilities. Integration with current technology. So consistency with current medical and rehabilitation technology guarantees a smooth transition into therapeutic procedures without necessitating significant alterations, and data processing and privacy. Handling substantial amounts of private neurological data, guaranteeing speed by process times and upholding stringent privacy and data security guidelines. So these four in technology changes is hard to overcome, but we have to. The second is clinical challenges. The first is customization of rehabilitation programs. So creating systems that can adjust the rehabilitation exercises to each patient's unique requirements and rate of improvement while guaranteeing that the exercises are fun and efficient. Next, clinical validation. Carrying out thorough clinical research to confirm the BCI system's efficiency in enhancing cognitive abilities and to make sure patients don't experience any negative side effects. C. Training for healthcare providers, creating thorough training courses to help medical practitioners use the system in the therapeutic settings and adjust possible resistance to adopting new technologies. The third challenge is ethical and social challenges. So consent and autonomy. Obtain each participant's informed consent and addressing any issue with the use of technology that directly interacts with the brain. Next, accessibility and equity. We have to ensure equitable access to cutting-edge rehabilitation technologies, and removing financial barriers are two ways to make the technology available to a wide group of patients. Psychological impact. Addressing the psychological impacts that BCI technology may have on patients, such as problems with dependency, self-worth, and autonomous perception. The last challenge is logistical and operation challenges. Scalability. Excuse me. Creating systems that can be expanded to serve a big user base without sacrifice functionality or care quality. Next, maintenance and support. Maintaining the system, continuing technical support, and making sure that any problems are quickly resolved to prevent disruption to rehabilitation programs. Last, funding and resource allocation. Obtain enough money for training initiatives, technology development, clinical clinical trial expenses and research, development and implementation. Okay, thank you for listening. That's my midterm report.